Waiting there at the helicopter landing site is a feeling of anxiety. The call coming in will tell us a very brief description of what casualties to expect, but to actually see it yourself is another different matter altogether. When the helicopter comes in, there's a lot of downwash, the heat, and then when you finally see the patient coming, sometimes it does catch us off guard, the severity of the injury.
Major Dr. Loh Hong Yi is a medical officer with the 20-man SF medical team deployed in a field hospital in Tarin Kot, the provincial capital of Postcards, Afghanistan. The SF medical team is part of Singapore's contribution to the multinational stabilization and reconstruction efforts in Afghanistan. Working alongside their Dutch and Australian counterparts, the team performed medical emergencies as well as trauma care for combat troops deployed in Afghanistan.
Most of the operations we do there are what we call damage control surgery or war surgery. For example, casualties with blown up limbs, bowels sticking out, gunshot wound to the abdomen, and so on.
Working in shifts round the clock, members of the emergency medical team stand by for emergencies while ward nurses make their rounds, tending to in-hospital patients. It is 24 hours a day, 7 days a week.
When you have a lot of patients, you have to perform all that. For example, giving medications, carry out doctor instructions, providing medical care, providing nursing care for all these patients in just one shift and handing over to the next shift. And we carry out other things like topping up of the ward stock in the hospital, cleaning up the beds, cleaning up the corridors, cleaning up the aircon, cleaning up the floors, and preparing meals for the patients and all that. We have to adapt to the language, learn a little bit of phrases from them. For example, if a patient say "daki," it means pain. Then I'll look at him and say, "You want piskari?" And I say, "Oh, piskari, okay. Piskari is medicine."